Healthcare Bill 2023. Mr. Speaker, the first thing I want to state is that I support this bill. I think the spirit to make sure that there is primary health care at the village level, at the ward level, is accepted. And Mr. Speaker, we want to state from the very beginning that that is the way we should go. Mr. Speaker, there are some improvements we need to make to this bill. Mr. Speaker, the primary improvement that I hope Majority Leader will listen in and see what we can do to improve this bill is that this Senate, constitutionally, Mr. Speaker, is established to help and protect the interests of the counties. Unfortunately, in this bill, while the spirit is very good and the spirit is acceptable, Mr. Speaker, we have created a lot of responsibilities in this bill to the minister at the national level in charge of health. We have given him or her the mandate to appoint the advisory council. Mr. Speaker, we have therefore given her or him the excuse to withhold funds at the national level to the disadvantage of counties. Mr. Speaker, counties have the delegated responsibility for health. And we must not give the national government excuses by law through this Senate to withhold funds that are supposed to be managed by the county governments. Mr. Speaker, the quarrel we have had with the national government is that they are still holding on monies at the national level when they could go down to the counties and be utilized at the counties. Mr. Speaker, this bill seems to create in clause number 13 that the ministry responsible for health in the management of primary health care, this is now at the national level. We are giving him or her the management of primary health care services. And on 14, clause 14, proposed clause 14, we are actually allowing her or him to set up the primary health care advisory council. And who are they being appointed there? He is supposed to appoint the principal secretary for health, the director general for health, their chairperson of the Council of Governors or their representative, principal secretary for the National Treasury, chairperson of the County Executive Health Committee, state, even chairperson of vice chancellors. Madam Speaker, or Mr. Speaker, when you look at these lists, it creates a perfect excuse to withhold more funds at the national level. Look at the functions that we have created for them. They are supposed to sit and advise under Article under 14 to advise the Cabinet Secretary and the county governments on matters related to delivery of primary health care. And yet, Mr. Speaker, at the county level, we still have the same. Because if you look at proposed clause 14, it says that each county government shall, in the management of primary health care services, it creates the same powers, Mr. Speaker, at the county level. Mr. Speaker, on proposed section 14 of this bill, you see again that each county government is supposed to establish a county primary health care advisory committee. So you could hear, Mr. Speaker, the majority leader when he was moving. He said there'll be 47 county primary health care advisory committees. 47. So for us in Tana River, we might have different requirements from those, say, in Nairobi. They will be advising us in a different way how we're supposed to deal with primary health care in our level. The ones of Nairobi will be dealing with their issues in Nairobi in a different manner. The ones in Lodwar, here in Turkana, they might have a different approach, Madam Speaker, Mr. Speaker. But then, we are then creating, on top of this, another bureaucracy at the national level. Mr. Speaker, I think we must come out strongly here and remove those roles that have been assigned to the national minister. Mr. Speaker, I really want someone to convince me that I need a county advisory health board, and then at the same time I need a national one. And in the national one, it's not my guy, it's not the guy from Tana River who is sitting there. It is the chair of the Council of Governors who is sitting there. And even if you put the caucus of health ministers across, how many times do they sit? How many times do they meet to create a consensus on that? Mr. Speaker, I think we will be giving powers to the wrong person in this particular case. And I think this will expose this bill to constitutional challenges, because the function follows, the money is supposed to follow the function. So if you create this advisory council at the national level, it means we have to fund it. And where is this money coming from? The money that is supposed to come down to our governors, down to our counties, is now supposed to be funding a national body that doesn't even visit us, doesn't know what we do, doesn't know what we do in Tana River, doesn't know that maybe traditional medicine is critical for us. And the way we want to do primary health care might be slightly different from the way maybe Mombasa or Nairobi might want to do it. And then you create a body that does not visit us, does not appreciate the role of primary health care workers at the local level. So, Mr. Speaker, I think we need to sit down and really give it a thought. Why are we creating this bureaucracy at the national level? Why are we giving them powers